Good morning and welcome to the program Perspectives. Perspectives this morning, Thursday morning, is a program sponsored by Kaduna State Ministry of Health. And we are here to talk about COVID-19, the situation world over and coming back home to Nigeria and even, close home to us here in Kaduna where we all are. And yes, coronavirus, still a reality and of course still killing. And of course, also on the rise, both at the international communities and of course back home here in Nigeria. And what we're doing about it, we'll get to know some of them. But again, the program this morning, we'll be looking at a situation back home in Kaduna State, where we are. Government making efforts to keep its citizens safe. But what are our responsibilities to staying safe too? Because if one is not safe, then all is not safe. That's the reality of it today. And we're getting from the international community that coronavirus now is taking a toll on people. The spread is coming largely from the youth population. That's what the reality of it. That the youth are the ones, spreading. The experience in Abuja yesterday was that bad, very bad. Government is saying that we should stay safe, keep a distance, and all of that. And we saw what happened in Abuja that for promotional exams or examinations, people were all gathered, and so what are we talking? We're just talking different about coronavirus. And what we're confirming today is that if the vaccine is not with us, we're just not safe anymore. It's the vaccine now that the world is, paying attention to. Sharing thoughts with me this morning, and to talk about it, I have Dr. Jimoh Ibrahim here with me. Dr. Jimoh Ibrahim, good morning and glad to have you again.
Good morning.
Yes, I gave a background that there is a frightening situation with coronavirus. Death toll on the high, and of course the spread also on the high. And the youthful population in the spread of coronavirus.
Yeah, thank you very much. You know why the youths are highly involved in the spread of coronavirus is because they're highly mobile. You see them in every aspect of the life, in schools, in the universities, in secondary schools, in the market. And if you look at this rural-urban migration, it's the youth that move to urban area. The elderly people are contented wherever they find themselves, but youths are highly mobile. So as a result of that, they are easy carrier. And unless they are observing this protective measures, I think we are in for trouble. And what is really surprising, what we saw yesterday in Abuja, is very alarming when government agents decided to conduct a promotion exam in an enclosed environment, choke up. So one is wondering, why are these people behaving as if they are in another country? The federal government just signed an order on to enforce this observance of this COVID-19 protocol. Unfortunately, these people decided to do what they like. I think the government is aware of the situations, and I'm sure they will take the right decisions.
All right. Again, doctor, on the death toll on the increase all over, but again, we see in some countries we have to put this with what is happening in other parts of the world, that the elderly are dying in advanced countries, so to say, and then you were talking about the youthful population here being the carrier all over of these, and so what is keeping us away, the elderly, in Nigeria?
Yes, if you look at our life expectancy, we hardly reach that very old age before most of our population died, and that is one of the reasons one may give as the reason why we don't have too much elderly high number of deaths in our country, because most of our populations are constituted by very young people who are highly mobile as a result, and their immune is more or less strong. But what I want people to take notice is not that we are not having deaths among those young people, because some people still have some underlying diseases. We started seeing even among medical doctors, people less than 40 dying. So people should not think when he's young he's protected. No, you are not protected. You are just being lucky that our immune system at the younger is still strong compared to the elderly. So that does not mean you cannot be infected. If you are infected, you can be down, and your means of livelihood will be affected. You can't go to your work. You has to be isolated for 2 weeks. So you need to take all this into considerations by making sure you observe these non-pharmaceutical measures, so as to make sure everybody is protected. So everybody have to take responsibility for their health, so that the society will be better for it.
Well, the whole world now relies on the vaccines getting, all over, to keep us safe. Now, see, if this is so, we just do not, well, we're hearing thoughts that it may come to Nigeria very soon, but you're talking about a population of 200 million people. And so, with what is happening in the advanced world now, is the vaccine now, that's where the whole attention is concentrated on now.
Yes. The vaccine is the only hope. But that does not mean when the vaccine comes, that will be the end of the COVID-19. But at least it will serve as a protective measures. Protect all those that are likely to be vaccinated. And in Nigeria, we are hearing that maybe before the end of February, we may be able to, we may be lucky to receive about 100,000 doses of vaccine. But if you look at 100,000 doses, compared to Nigerian population, it's like we've not even started. Although we learned that the 40 million doses will follow, but that one, no one is sure when the 40 million doses will be available. But the federal government is targeting about 150 million between 2021 to 2022. So we still have a long way to go. So the only measures we have now is people to observe these non-pharmaceutical measures, regularly wearing of face masks, avoid unnecessary crowd as much as possible. If you are in a crowd, maintain some physical distance, and wearing your face mask, and regularly wash your hand with alcohol-based hand sanitizer if there's no soap and water.
Well, again, to avoid it, to avoid each one of us, from getting this infection. What is about to happen in Japan? That the games in Japan, Japan has said that it will go on, with the games, but again, it will stay with the protocols and so. But we're talking about. We just mentioned the government agency that had. Promotion interviews with staff that were in large number, and so government is the one in charge, taking charge of keeping us safe here. But we've come to realize that we are on our own, and attitude must play a very big role in keeping us safe from coronavirus. But again, looking at attitude, Nigeria, we've never been good at that.
Yes, it's also, human being generally is anything change. It's always, people always resist it. People are used to their whole style of behaving, and this disease have taught us that we have to change our behavior, and that's why we are doing these behavioral change communications. The wearing of face masks, regular hand washing have to be imbibed into all of us, and the earlier we understand this, the better. And that is why the act of governor, the world activities have to go on. That is why the Olympic in Japan have accepted to organize the Olympic despite the COVID-19. But the only hope that we're having that all the participants will be immunized before you can't be allowed to enter the country, and the significant number of the indigenous of the Japan also will be immunized in addition to the following the guideline and protocol of COVID-19. I think the world will be safe for that if they were able to immunize most of the participants, including the athletes and the officials.
Some countries of the world have gone on a second lockdown. Now, we're coming back into Nigeria, that with what happened with the lockdown and palliatives, it was a terrible experience. And so that we may not, Lagos is showing very serious signs of a state that highly affected, with COVID-19. But again, we just do not want to have another experience of a lockdown.
Yes, the economy is very bad, and we are currently in recessions. I don't think the government will be able to afford another lockdown, because how are they going to survive it? if the economic activity is paralyzed, people have been shouting of hunger in town. So whatever we can do to prevent another lockdown, I think is the best way to go for the country. Otherwise, it would not be a good procedure to go.
Well, let's come back home to Kaduna. What is coming out of Kaduna State with COVID-19 or coronavirus, as some people say? What is happening now? We know that we are on high with COVID-19 and deaths again coming. So, what's the situation?
Yes, Kaduna State is trying its best. The mass testing is still going on at our designated center, and all the civil servants have been directed to go and take the test. So it's whether you like it or not, all the civil servants have been directed to go and take the test so that they would be able to know the status. These civil servants are coming from the communities, and they don't want the agency, ministry and department to be a source of spread of infections. And in addition, they are trying to enforce these non-pharmaceutical measures at different ministries so that people will be able to stay safe, and society will be better for it. I think that is the situation. The number we are having keep on fluctuating, and that is not to say we are there yet, because number of people coming forward for the testing is not yet encouraging. So people should please come forward and go to all those designated centers in all the state's general hospitals. So they are free. People should go there and take their test so that they will know their status. And when they are positive, they be asked to be isolated as soon as possible, so that the chain of transmission can easily be broken in the society. Yeah,
but doctor, we are all at risk, of COVID-19, and the father, the husband would go out to, earn a living and come back home. Of course, the woman of the house too probably have to go out too, and children will go to school, and of course we still want to observe the tenets of our religion. We go to our places of worship and all of that. The marketplace is one place that we get the crowd too, and of course infections can take place there. So much as we want to be safe, but again we just find that we're exposing ourselves to very unsafe areas too.
Yes, but life have to continue. If you allow COVID-19 to drag everything down, I think it will be in for trouble. See, the children have been at home for the past 1 year. So what the government did in that aspect is to give her the protocols, guidelines as a condition for the school to reopen. And any school that satisfy all those things have been asked to open. And initially, they realized all the higher institutions in the state satisfied those conditions. They were given go-ahead. Now the primary school and secondary school have opened. But the selected opening of the primary school and secondary school are witnessing, as it's not all the classes have been allowed to come to school, so as to reduce the congestion as much as possible, pending the time the school be able to establish all those protocol measures in their schools, so that all the children will be safe. And also the enforcement of face masks, very, very important. And maintaining social distance in the schools is also very important. But above all is to reduce crowd as much as possible. That is why they allow these selected classes to resume in the school.
We are a unique set of people in what we do. The vaccine, some people, public analysts, are even looking at it that yes, when they do come down, that we are, can have it here. The issue of corruption is one pointer that holds Nigeria. Nigeria is on the high with its corruption level again, and so some people are saying that even when it gets down here, some Nigerians would take advantage of other Nigerians. Man's inhumanity to man may play out here. So getting the vaccine could be just one thing, but having it go round again could be another issue.
Yes, it has to be strategically given, because we know people who are at the high risk. All those people will be sorted out. Those are the health workers who are the front lines, who have access to all those people who are infected, need to be vaccinated. And I think That's what is obtainable in other developed area. Also, the elderly people will also be considered according to government because they are at high risk. Then the government officials, in order to demonstrate trust, because there have been all these mistrust and misconceptions going on and online, so the politicians need to come forward to receive it in public, so that people will be sure that the COVID-19 vaccine is safe and will be available for everybody.
Well, it's at a time where we just do not know how it's going to end, because the variants that are coming out again, bringing out some concerns that while we're about to go for vaccines and all of that, we're getting variants of it, and that could also be a thing of concern.
Yes, it's actually a thing of concern, and that is the reason why the developed world should consider the developing countries in the distribution of the vaccines, because most of the doses of vaccines in different companies seems to have been hijacked by these developed countries. And even the World Health Organization have been shouting there's need for this thing to go around, so that you don't give an opportunity for this virus to start developing another variant. Because if you, even after the production of your vaccine, and there's a mutation, and another virus of another mutate virus emerge, it may be resistant to that vaccine. So the earlier the is evenly distributed, so that everybody will be vaccinated almost at the same time, the better for it. That is concerned. But right now, we've not seen any variant that is resistant to the already produced vaccine that we have seen. As most of the vaccines are said to be effective against all these variants, including South Africa variants, Nigerian variants, even the UK variants that we have seen.
Yeah, Doctor, again, on this issue of there's rumor, there's misconception, there's misinformation all on COVID-19. What we're getting from, especially from the social media, is that Africa is the center where, been said to be where they want to take out Africans, reduce population and all of that. So some people are even going, don't take the vaccine, and all of that is going on now. And then we saw, I take you back to polio eradication. What happened with the polio thing? That it was just one way to reduce population too, and for people, childbearing not to come. And so all of these, in getting the vaccines to all of us, do we have to do more than we're doing, especially on educating and informing the people about the safety of it? America, they were seeing the president come out in the open with his vice to get vaccinated. But here, are you worried too about acceptance of these all over?
Yes, if you look at all this information coming out from social media, one should be worried, because it gives a lot of misconception to our people. And we have a youthful age who are highly dependent on this online media. Most of them hardly listen to radios as we are speaking. So they take this misinformation they get in their as a hook, like, and sinker. So the government need to do more in terms of enlightenment, and they should come forward to build trust, because they have been mistrust for a long time. But what I want to add to that is that people should disregard most of the information online. Some of them are fake and they are not reliable. In any drugs or vaccine, you see occasionally 1 or 2 people that will be reacting. It's like 1 in 100,000. So we call it idiosyncratic reactions. It happens in all the drugs. Even some people, when they take paracetamol, they react to it. But that does not mean you should condemn the whole drugs or vaccine for the rest of people. So we see occasionally people react to this thing. That does not mean the vaccine is not working. At least what is most important, and that is the reason why they said they are 96% effective, 98% effective. You can hardly see any drugs that is 100% effective. And when this vaccine is being given, there's what you call post-marketing surveillance. People are trained to be monitoring the effects of this vaccine. Is there any reaction? So that if there's any untoward effects in the process, the drugs can easily be withdrawn from the market, and the solution will be provided. So the vaccine is effective and is efficacious and is good for people. So people should please when the vaccine is available, they should come forward to take it.
Yeah, we're also recording deaths of elderly people, and some people will say even the rich. We see them now that, and most people will relate cause of death to coronavirus, and they underreporting of what happens in the rural areas, and of course in densely populated areas. We don't get to see it. So some people would interpret it to say that coronavirus could just be for the sickness of the rich, and it's a class thing.
So it's a big fallacy for somebody to say it's a disease of the rich. It's disease of the whole. It can affect anybody, whether you are rich, whether you are poor, whether you are middle income people. So everybody need to take the disease very seriously, and that is why it's affecting everybody globally. It has affected the the Prime Minister of UK. It has affected the poorest person on earth. So in most cases, you don't hear cases from the poor people. That's why people think it's the disease of the only rich. No, it affects everybody. It's only when you go to isolation centers and you will know that it affects all cadres of people. So it's not, specific for any particular class of people. So it's for all, and everybody should take it as a very serious problem, and so that we observe these preventive measures.
Well, back home here in Kaduna, we know that government has, done a lot, to keep citizens safe. Isolation centers are there, and treatment, money for treatment. Government, takes the burden of even treatment, and all of that. But let's take from the Lagos experience, where the hospitals are becoming overwhelmed with cases of coronavirus, and then because it's a respiratory thing, oxygen is sold at the black market now for exorbitant prices, and so must we be taking a cue that yes, that's on the high now, and of course people are getting infected now. So with the Lagos experience, can we learn? Can we take some things back home that we must be getting ready in Kaduna State?
Yes, Kaduna have been proactive in readiness for in case there's a surge in number of infected people. I told you they are plan on the way to establish isolation center in all the local governments. Then in addition to that, they are also planning for home management. The committees are putting things in shape to make sure people that are able to meet the criteria for home management are managed at home, so that there will be less stress on the isolation center, because it is clear that no matter the number of isolation centers we have in Kaduna, it's not everybody that will be able to be managed there. It's only people with severest form of it may be taken to the isolation center. People with mild or asymptomatics can be managed at home, provided they meet the criteria that government will soon be rolled out.
Okay, and Doctor, the protocols are there. We all at this time know what the protocols are saying, keeping ourselves, safe, hand washing, social distancing, and of course wearing of the face mask and using the hand sanitizer. We all, are getting aware of it now. But one thing still stands out. Can there be, some preventive measures to take, before you get to the doctor, or before you get to the hospitals, or the other things to also that we can, take to, get ready? For before we get knocked down by coronavirus.
The problem with coronavirus is there is no clear medication for the treatment for now. It's not yet clear, though there are some claims which has not been clearly verified by local distance. So there's no clear medications for that, and that is why we say prevention is better than cure. It's better people prevent themselves rather than now having the disease and now start running up and down to take care of themselves. And the reason why we don't want to advise people to start taking something which is not yet clear, because if you are told to take certain aspect of it and it didn't work for you, you say no, this thing is not working. There's no clear medication for coronavirus, and what we are treating at the isolation centers is symptoms, is whatever you are present with that you'll be treated with. So It depends on, and people present it in a various form. Some come with fever, some come with abdominal pain and diarrhea and vomiting, and so on and so forth. And some people come with difficulty in breathing, and those are the people they prescribe oxygen for when they have shortness of breath. So it depends on what you are presenting with. And the virus is self-limiting. Within 2 to 14 days, if you don't die within that period, and you don't develop complications like a pneumonia, you are not likely, the virus are likely to fizzle out in the process. So even if you are asymptomatic, you don't need to take anything. All what you need to do, mild exercise, take fluid, be eating very well. Your immune system will fight for yourself, and at the end of that 14 days, the disease will fizzle out. What we are trying to do in isolating you so that you don't spread to others. That is the essence of the message. It's not that we are doing a certain miracle for you when we ask you to come to isolation center. And that is why if somebody have a comfortable house, he can as well be isolated at their house if you are sure it will not be a source of infection to other members of the family.
The program is Perspectives, and it's coming to you on Invicta 98.9. This program, Thursday, Tuesdays too, but today is a Thursday, is sponsored by Kaduna State Ministry of Health. It is to inform and, of course, to bring you updates on coronavirus in the state and, of course, in Nigeria. And with us in the studios this morning, Dr. Jimoh Ibrahim of the Barau Dikko Teaching Hospital, telling us, giving us an update of what is happening. When we come back after this break, I just want Doctor to prepare himself to tell us again, too, symptoms, what we can have when we begin to observe some symptoms, when we must, rush ourselves, to the medical center. Come back after this break.
Right back after this. We'll be right back after this quick commercial break. Are you serious? For real, are you serious? Invicta FM. Let's start the party. Ladies and gentlemen.
You are gonna love this show. Invicta 98.9 FM.
Welcome back. This is the program Perspectives, and we are talking about coronavirus and where we are with it. Update of it has been given to us by Dr. Jimoh Ibrahim. Doctor, before we went on that break, I was saying that just what are the symptoms to notice to give us concern that this is time to get to the testing center, or when we begin to see the signs, what are the signs to get us worried?
Yes, thank you very much. If you have fever, whether you are currently feeling feverish or you've had fever in the last 2 weeks or within the last 2 weeks, plus dry cough, plus or minor shortness of breath. You can have shortness of breath if it's becoming complicated. Then you can also be having shivering, body general feeling of unwell. Then if you have loss of smell, loss of taste, headache, abdominal pain, vomiting and diarrhea, any one of these in addition to that dry cough and fever, please go to a nearest testing center where you can easily be tested to know your status. Don't think you are having malaria, because if you look at these symptoms very well, the malaria can also present this way, because you can have malaria and upper respiratory tract infections ordinarily, where you be having catarrh, cough and fever. So it's only when you do test that you can confirm it's COVID. So, and even if it is malaria, it's only when you do test you can say you are having malaria. So my advice, and it's possible that COVID-19 is coexisting with malaria too. So don't do malaria first and assume it's only malaria that is wrong with you. You can be having malaria at the same time having COVID. There's nothing stopping you from having COVID. And it's only when you do COVID-19 test, you know that you are having COVID-19 or you are not having. So people, and another thing, people can even be walking around even without these symptoms, and they are carrying the infections, infecting others. And those are even the dangerous people. Because if you see somebody coughing, you can easily say, hey, what's happening here? Let me protect myself. But when you are talking with somebody who is not coughing, you are just gisting, meanwhile is releasing doses of virus to you without you knowing. So those are the dangerous people that are fast spreading disease in the community. And 80% of these people that are carrying it are asymptomatics that I hardly know. And that is why we're having only a few people being taken to isolation center when they confirm. So my advice to people, let everybody come forward and do the test. It's only by doing the test we know your status.
Okay, and then again, the prevalence of it in 23 local governments that we have in Kaduna State. So where are we seeing high rise of it?
Yes, we are seeing high rise because there are already community spread of infection and few people that are coming down. Before, when you take like 20 samples, maybe you see 2 people positive. Now when you take 20 samples, 12, 13 people are positive. So which means when you take higher number of samples, more people will definitely be positive. That's the evidence of community transmission. Because we hardly, before the case definition involved traveling out of your from a highly endemic zone. Now that everywhere is pandemic, I mean is having the virus, and we have history of people that never got out of their locality having the infections. So where did they get it from? So that is why the case definition have to change from history of traveling outside your domain to bring it back to these community-based case definitions, and that's how we arrive at this new case definition. Before we used to have history of traveling to it, but now nobody care whether you travel or not because there's evidence that there's ongoing community transmissions.
And this rural urban movement too, it has added to or increased the spread of the virus.
Yes, people going on from urban city going to village, they are likely to take it back to their parents and start infecting people there, because the thinking is that the level of spread at the rural area is not as much as urban area because of dense population at the urban area. And of course, people are highly mobile. They can go and visit their relatives, their family, and in the process they can easily infect others. And that's why we have to spread the testing to all the 23 local government. And it has shown that everywhere in Kaduna State, even Binungbari, that are having security challenges, people are coming down with COVID-19.
And would that mean that we should reduce traveling or movement?
Yes. The most, during lockdown, the essence is to restrict movement from one area to another, so that the area that don't have it, people don't go there to go and infect people. That's the essence. We should, for now, please travel only when it is absolutely necessary and avoid crowd as much as possible. And any community should come plan their own, even without government interference, plan their own community safety, but have a task force to make sure people that come home are easily identified and maintaining all this social distancing and other measures that are protective, so that the spread of the COVID is reduced as much as possible.
Oh, okay, we'll come to you now, the audience. Let's get to hear what is happening around you and your concerns too. It is the virus is on the high, and people are just spreading it. And of course, in the course of our discussion here, you've heard that the youth population, are the carriers of it, and so much of it can come from our youth who are up and mobile, so to say. And so numbers to call for us to get to know what's happening around you and your concerns in your area, and where you would want even government attention to be on. Call these numbers: 081 40 989, 081 40 989, or 070 87 800 989, 070 800 989. We also do know that sometimes we stay at home and we don't go out to do testing. We just think that we can do our local treatments, and that's one area, doctor, that we not talked about.
Yes.
Taking herbs and all of that.
We don't have any evidence that any herb so far can help in the treatment of COVID-19. look at the Madagascar claim, which has fizzled out after some time. So there's no evidence that.
Yeah. Okay. Let me launch this caller. Hello. Good morning. Good morning.
Hello. Good morning.
Yes.
Yes, sir. This is Mr. Abin Bamboye Mando.
Okay, Bamboye Mando.
Yes.
Okay.
This issue that Nigeria were just like dry garri that we never obey the last order to see hot water. It's a very pathetic something. In Mangotu, everybody just talking about no guy, no mad guy, nothing. And I don't know. We are afraid that God will really minister to us. And people are dying every day. They just a short illness. They heard that somebody is there. Yeah, because they are just receiving call from a fight. That somebody that was not just back away from them. So doctor, I want to ask again. This question is a visitor coming to visitor comes as a day of going. Or they have come to buy land and to build house and stay among us.
Can you come again?
Yes. Mr. Bamboye.
I said this COVID-19 is a visitor. You know when the visitor comes, we have to go that we go.
Okay.
Or I come to buy land and build house among us and be part and parcel of us.
Okay, all right. From what I got, so that way comparing people as to dry garri, that's a new one on me. But again, that's talking about why we're changing, attitudes. It's difficult to have that. But again, he now mentioned that is coronavirus a visitor? Does it have a time limit that it can stay and go?
What you need to know is that COVID-19. Eradication of COVID-19 will depends on our behaviors, change of attitude. Because what I'm saying, so even with the arrival of vaccine, the vaccine cannot protect you from exposure, being exposed to the virus, if you are not wearing face masks and maintaining social distance when you are in a crowd. The vaccine can only protect you, and we don't know for how long the vaccine can even protect somebody. We have little knowledge of how long. Is it lifelong immunity, or is it 2 years we have to repeating the vaccine? So everything depends on our change of our attitude, whether it's going to be a visitor or it's going to continue to live with us for the rest of our life. So, but we must accept that these new behaviors has come to stay for now until something drastic happen.
Okay. All right. I have this caller. Hello. Good morning.
Hello, good morning, sir.
Good morning.
Good morning to the doctor.
Good morning, sir.
My name is Comrade Gabriel.
Yes, Comrade Gabriel.
So what I wanted to ask is that once this vaccination are coming, will it be given directly to the people whether they have symptoms or don't have symptoms, or how are we going to know that somebody is having a symptom? For example, if somebody is having coronavirus, will he still be given this vaccine, or will he be probably managed before giving that vaccination? Because we don't know whether we just come directly and start giving people the vaccination like that, even if you have this or didn't have it. I don't know how they are going to do it, sir.
Yeah.
Okay.
Yeah, thank you very much. That's a very pertinent questions. The vaccine will only be given to. We don't give vaccine when somebody is sick. That's number one, because vaccine itself is a heavy burden on somebody's immune system. So you would like that individual to recover before the vaccine is given. But it's only people that, whether you are asymptomatic or symptomatic or not, you have to do tests before we can know whether you are symptomatic or not. So if you are asymptomatic, of course we can give you the vaccine can be given to you. But the way they are going to start with, they will look at who are the high risk people first, vaccinate all those things before it become general. And when you are very sick, nobody will give you vaccine. Not only for COVID, it affects all the other various of vaccine.
Okay, another caller there. Hello, good morning.
Hello, good morning.
Good morning.
Yeah, it's Buba Umar.
Buba Umar.
Yes, sir. Now, most of the time, when we domesticate pandemic, we may notice an upsurge or spike, which in turn what we were seeing now. Now, so also, if we domesticate, there are some measures which need to be taken. Now, the measures are government dependent. You pass on to pandemic to community. Now, what are you doing to that community to see that yes, measures have been taken? Now, if you domesticate, one of the stages we see is fumigating the community. Now, the second aspect is increasing the testing. Also, bringing awareness to communities. Now, all these three activities are not going. What we see is government are taking measures, possibly on lockdown or enforcing laws. So, what are we doing? If we didn't increase the things, definitely the number will keep on rising and rising. So thank you very much.
All right, okay. Buba Omar, we got you on that. You mentioned the aspect of fumigating and also, talked about, what government can do. Well, you're taking.
Yes. You talk of awareness. Is this awareness
that's what we're doing now? Yeah, we're doing that.
So, and it's a radio awareness. We think every part of the state should be able to access the radio. So, and it goes on in all the media houses in Kaduna. So, it's not only Invicta. So, we are also doing tests in all the local government. Initially, we are doing community testings until when we now move it to designated centers for sustainability basis, because when you are doing community testing, people have to be taken from health facility to start moving around the community. And how many are the health workers? So government have to think out of the box. Okay, with the awareness, let the people know their health status, let them go to health facility to take their sample.
Can you have another caller there? Hello, good morning.
Hello, good morning, Mr. Toyala.
Good morning.
This is Ahmad Sadona and Adelili calling.
Ahmad, let's hear you.
Talking about this issue of COVID-19. Sincerely speaking, those that are spreading false foods about this COVID are much more than the government or the people that are spreading the right information. Since I know that governors or politicians used to sue somebody for misinforming the public if they have talked bad against them. So what is the government doing in order to see that they use one of these people spreading false news and calling COVID-19 scam and misleading the public? What is the government doing in order to show example with one of them, so that at least if you do not believe in COVID-19, you should hold it for yourself. You don't have to be misleading other people about the non-existence of COVID-19. And that is, by the way, I want to ask the doctor, is there any way they used to test this COVID-19? Because the way they put something inside people's nose, some of us are like,
Okay. All right, Ahmad, we got you, doctor.
Yeah, thank you, Ahmad Sadauna. I hope government is listening to you, but most of the falsehood we get is through the social media. We hardly people. I don't know any media house that we allow an individual to come and spread falsehood. So, and social media very difficult to control. Government have been trying their efforts to regulate that area. Concerning your questions, for molecular testing we are doing, which is a PCR, the only acceptable site for now is still mouth and the nose. And this test is within seconds. Within 10 seconds, they can take whatever sample they want to take your nose. Yeah, and it's just inconvenience they will cost you. There is no giving you any pain. So people should just sacrifice. It's a means of sacrifice to make sure this test is done. And we
bear the pain for the 10 seconds or whatever.
No, it's just inconvenience. It's not painful. It's not inconvenience, and it's brief. And as long as they remove this cotton board labeled test kits, you are okay.
Okay. All right. Okay. Yes, we can. Can I squeeze in a call? Hello. Good morning.
Hello.
Good morning.
Good morning, Mr. Toyola. Good morning, doctor.
Yeah, good morning.
This is Mr. Bello calling from Narai.
All right, Mr. Bello, let's hear you.
I have one observation and then one question. But let me start with the observation. That's what really is bothering me.
Yes, go ahead.
A lot of people. Hello?
Go ahead. Yes, we're with you.
A lot of people don't take care of their hygiene as it ought to be. Since this COVID-19 is trying to bring to our attention our hygiene, a lot of these face masks.
Oh. All right. I hope you can just call back Mr. Bello. But if I want to get to, try to get something out of where Mr. Bello was going on the face mask, we see all sorts of face masks, and again, you could see some very dirty ones, and you could see some, and where this face mask, most people don't take it up to the, to cover the nose. Most times it stays below the mouth, and so that's a process.
That's why people wear all sort of face masks, and the majority of community now, because of the availability of those people selling those surgical face masks on the street, they want to copy what medical or health workers are using, so they are fond of buying those things. But my advice to them, you can't rewash all those ones, because the moment you put it in water, it gets spoiled. So the only prescribed face masks acceptable to general population would be the one made from different fabrics. Clothes, you can use different clothes. What is the most essence is to protect your nose and mouth, so that when you sneeze or somebody sneeze, it doesn't get into your mouth or nose. And that you can rewash it, because face mask should not be another source of infections. In fact, when you move around with it, you see dust, all sort of things accumulating there. When you get home in the evening, the most important thing is to wash it and dry it over the night, so that when you are going out the following day, you can. But when you are using the surgical face mask, you don't have that opportunity. It's a disposable. We use it for one day. In fact, for 4 hours when we are in a health facility, we throw it away and wear another one. But it's not advisable because of the cost to a general population, and we want people to comply, so that the issue of money will not be so if you have 2 or 3 just face mask made from different fabric, you can be using it for months. All what you need to do is to be washing it daily when you use one.
Well, Doctor, we're getting close, to the end of the program. Again, you leave us with your last line here.
Yeah, my last comment I want to make is COVID-19 is still very much around, and is ravaging the world. And if I may compare my figure with the last one, the world over the death to now is about 2.2 million. And America, who is an epicenter, have recorded 461,000, in excess 461,000 deaths, followed by India, where they had about 154. Coming to Africa, we have an epicenter in South Africa, where over 45,000 people have died. Nigeria is just in excess of 1,600. But I want to tell you, our figure is not reliable. It's hospital-based figures, so we cannot be celebrating, because there are so many deaths unreported, ongoing in the rural places, in our communities. People are dying in numbers without know the cause of death. So most likely they are likely to be the COVID-19, especially among elderly people and people that have underlying disease. So my advice is for people to observe these non-preventive measures. Wear your face mask anytime you are going out, regular hand washing with alcohol-based hand sanitizer, and maintaining physical distance when you are in a crowd. Thank you very much.
Thank you. And that will just be the size of it on the program Perspectives today, a program sponsored by Kaduna State Ministry of Health to get us informed and educated, enlightened too about COVID-19, the reality of it. It's all over, and of course, it's taking its toll on lives. And so we'll come back with this program again on a Tuesday of next week. We'd like to thank Dr. Jimoh Ibrahim for availing us this time to be with us. Thank you, Doctor.
Thank you.
All right. And my colleague, Dashim, thank you for connecting me with the people this morning. We'll come back with Perspectives tomorrow. Good morning.